Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the regional terms that we can use to describe parts of the body. When we look at this image that shows all the different regional terms, or at least many of them, that are used to describe the body, it can be a little bit overwhelming to see all of these new words. My goal in talking to you about these things is to help you get some ideas of how to organize them in your mind, or to locate them on your own body. Because guess what? When we're working with these regional terms, you do have access to your own body when you're answering these kinds of questions. Let's start over here on the right side of our page, where it talks about the two main divisions of the body. These divisions are going to be really important when we start talking about the bones of the body, but they're also a good big picture way for us to start organizing regional terms. When we talk about the two ways that we organize bones in the body, the first way is what we call the axial skeleton, or the axial region of the body. The axial skeleton is everything that we find along the midline of the body. So it's going to include the skull, the bones of the chest, it's going to include parts of the pelvis, everything along the main axis, or the middle of the human body, is the axial region. Everything that relates to the arms or the legs is considered part of the appendicular region. So the first big picture way we're thinking about the body, are you in the middle, axial, or are you on the limbs, appendicular? Then we go into each of the major regions of the body. Some of these regions we talked about with our body cavities. For example, the chest area is called the thoracic region. Down below it is the abdominal region. If we look on the back side of the body, all of these are part of the dorsal region. So these are some of our biggest picture regions of the body that line up with some of those body cavities we talked about. Notice that when we look at some of these regions that we talked about in terms of the cavities, there are a few more specific ways to describe those regions. For example, in my thoracic region, I have what's called the sternal region in the very middle, where the sternum bone would be located. Next to that, I have what's called the mammary regions, where the mammary glands or breasts are located. And on the very far edge of that thoracic cavity is what we call the axillary region. Now that's a weird one. We can't maybe memorize that quite as easy as some of our other ones, but here's my hint for you with the axillary region. Sometimes we can take an axillary body temperature, especially on very young children. So an axillary temperature is when a thermometer goes into the child's armpit to take the body temperature. So let's review. In our big thoracic region, we have the sternal region in the middle, the mammary regions on either side, and the axillary regions in the armpit. If we go to the back side of the body in the same general area, let's look at some of the regions that we have there. Starting with your shoulder blades, these shoulder blades are a bone known as the scapula. So the scapular region is what we have on either side of the back of our chest. In the very middle of the chest, we have what's known as the vertebral region. The vertebral region gets its name because this is where the vertebrae, the bones of your spine, are found. And in the lower back, we have what's called the lumbar region. The way that I like to remember the lumbar region is if you get back pain in your lower back, that's called lumbar pain. So the lumbar region at the very lowest part of the back, the vertebral region in the middle, and the scapular regions on the side. Now let's start transitioning down into the legs. When we talk about the legs, some terms are the same on the front and the back, and some terms are different. Since we were talking about the back side of the body, let's start over here with the backside regions. In the buttocks region, we have what's called the gluteal region. If you've ever heard of gluteus maximus, that's the big muscle that we find in this region. So the gluteal region, the buttocks region. Down below it, your thigh is considered part of the femoral region. That's because the femur's underneath it. Notice that the femoral region also includes the front part of the thigh. So femoral is a term that applies to the front and the back of the leg. A term that's specific to the back side of the leg is this region right here, called the popliteal region. Think of the popliteal region kind of like the knee pit, if you will. We don't actually have a knee pit, right? But it's on the opposite side of the knee. So in the back side of the leg, we find the popliteal region behind the knee. The front side of the knee is known as the patellar region. This is because there's a bone inside of it called the patella. So the patellar region in front, the popliteal region in back. And when we go down into the calf, there are two different terms that we use to describe the calf. These terms relate to whether you're on the outside, the lateral side, or the inside, the medial side. On the outside of the calf, we have what's called the fibular region, or sometimes this is called the peroneal region. Both of those mean the same thing, that we're on the lateral side or the outside of the calf. The reason we call this region the fibular region is because the bone called the fibula is located in this region. The medial part of the thigh, what's in the middle, is called the sural region. So the sural region toward the middle, closer to the tibia bone, the fibular region in the back. When we're in the very front, talking about the innermost portion of your calf, we would call that the crural region. Study pro tip here. Lots of words, all describing things in a similar region. I promise you, I won't judge you if during a quiz or an exam, you reach down and touch your fibular region, or touch your crural region, or touch your sural region in the back. So, as you're learning these terms that are new to you, literally feel them on your body. The more ways we can get things involved, the better off we'll be. We go down into the feet, and with the feet, the big things we need to make sure we know is that the ankle bones as a group are called the tarsals. In front of the tarsals, the flat part of your foot, we have a group of bones called the metatarsals. Metatarsals are long and straight, so the metatarsal region is the flat top part of your foot. If we go to the flat part of the bottom of your foot, this is called the plantar region. The plantar region, as in plantar fasciitis, if you've ever heard of that before. That's an inflammation of the connective tissue on the bottom of your feet in that plantar region. We also have on the foot what are called the digital regions, digits as in the toes. Technically, the big toe has its own name. The big toe is known as the hallux, or the helical region. So digital regions for most toes, except for that big one, called the hallux. This kind of naming pattern actually applies to the hands as well. So let's start with this digital region. Again, the digital region always refers to the fingers. When we look just above the digital region, we see the palmar region, the palms of your hand. Notice that like the big toe, the big finger has its own name. The big finger is called the pollex. So the hallux, the big toe, the pollex, the big finger, the thumb. All of these are connected to the arm at the carpal region. The carpal region is where you would have inflammation if you have carpal tunnel syndrome. So carpal tunnel syndrome is when there's pressure or pain in this wrist region. As we work our way up the arm, we see very similar naming patterns to what we saw down lower. So as a whole, your forearm is known as the antebrachial region. Ante means before, so antebrachial is in front of or before the brachial region, which is the larger part of your arm up high. In between the brachial region and the carpal region, we have something that's called the antebrachial region. Oh, I apologize, I said that one already. The antecubital region. The antecubital region is the name of your armpit here in the middle. It's on the back side, known as the olecranon or the olecranal region. When we talk about bone markings, we'll learn that there's a bone marking here in the back side of your elbow. This is why it hurts so bad when you hit it. That marking is called the olecranon. That's how it got its name. Last region that I want to cover with you briefly is the head, the cephalic region. When we're naming the different regions of the head, these are going to line up very well with the bones we're going to be talking about in a few weeks. So your forehead region is known as the frontal region. The locations of your eyes, the orbital region. This is because your eyes are found inside a deep socket known as an orbit. When we go to the middle of the face, at the nose, we have the nasal region. Down below it, the mouth, the oral region, like the oral cavity. And the last regional term on the front of the head is the mental region. Now, this is one we're just going to have to memorize. I don't have a good trick for it, but the mental region refers to your chin. So, mental region, that chin. On the back side, we can see a region at the base of your skull. This region here at the base of the skull is called the occipital region. This is going to be important when we're naming the bones of the skull. This is the most inferior or the lowest of those bones. The otic region over here, encompassing both of the ears and connecting the head as a whole to the thoracic region of the body, is this cervical region. Cervical meaning the neck. I've just spit out a ton of different regional terms with you. Like I mentioned, please make sure that we can feel these regions on our own body, and please make sure that we can answer questions like this. So I've highlighted for you specific regions of the body, asking you to apply your regional terms. With each of these regions I've marked, there are specific names for them that we talked about. So when we talk about the arm as a whole, we have a name for the upper part of the arm, which is different than the lower part of the arm. Or with the leg, the thigh has a different name than the parts of the calf. When we're looking at that lower region in the back, the region that I told you can a lot of times get inflamed, as with that region underneath the foot, that can also get inflamed. Use these practice questions as a good way to quiz yourself to make sure that you understand these regional terms.